Welcome to The Lifestyle Herbalist, the podcast where holistic wellness meets everyday living. I'm your host, Dabney, registered dental hygienist, clinical herbalist, and certified health coach. We're passionate about bridging the gap between conventional medicine and plant-powered healing. Whether we're diving into oral microbiome health, the power of adaptogens, or just simple steps for vibrant living, our goal is to help you feel empowered with practical, science-backed, and earth-grown solutions. So grab your favorite cup of tea as we dive into this episode. Good morning and welcome back to the Lifestyle Herbalist. I'm Dabney, and today I'm going to go off the cuff. I have just finished a round of talks, presentations, if you will, at my local university. There is something there called Lifelong Learning Institute, and it's for people who are interested in certain topics. And the topic I've been talking about is vital aging and what that means, especially for women as we get older. And then yesterday, I was at a women's health conference, again with JMU, a different section. But when I went around the room to ask folks why they had planned to come to my session, even though the topic was vital aging, what they were most interested in was oral health. They had so many questions about oral health that I thought, wow, this deserves its own topic. And what does that mean for me in the future with topics that maybe I will just branch more with oral health? Because there just seems to be a lot of questions out there. You know, Hippocrates said years ago, well, a long time ago, let's say, that let food be your medicine and medicine be your food. And at the foundation of even oral health, no matter what, with my patients, with my clients, with my friends, we always start there. What we have on our plate matters. The things that we choose to put on in our body matters. And is especially true with oral health. You know, the window of our body is our gums, it's our teeth. And if things aren't looking healthy there, well, things aren't going so well inside of our body. And I have to say, our body is amazing. Like God made our body so incredibly amazing. It has the ability to heal itself if we give it the tools. It goes as long as it can for an amazing amount of time, even though we don't always treat it the best. So today I want to talk to you all, my audience, about oral health and maybe answer some of the questions that came up over the course of these talks with these participants. So people they're vulnerable. People will tell me their hygienist recommended that they have deep scaling, but they're just not sure. They don't trust their hygienist, I think. Otherwise, why would you question it, right? So there might be a little bit of mistrust, especially when a new person sees a patient and now they're hearing new information. So I understand that part of it, and I've been on the other end of being the new hygienist and what it means to kind of bridge that gap and cross that bridge to build trust. I will say, not every dental professional, we're not all the same. Some people are really deeply stuck in tradition and how they learn things in school. But let's face it, dental hygiene, dentistry, it's a science. There is constantly new information coming available. There's new techniques constantly emerging. And if we practice when we're in 1960, well, are we really doing our patient the best service? As a preventative agent, I would think and I would thought that, wow, my patients should all be healthy by now. But yet, oral health, like many other things, is multifactorial. When I talked to the audience about mouth breathing, there were a lot of questions that came up. Well, why does that matter? Well, I'll tell you why. Because when somebody is breathing from their mouth rather than from their nose, you're actually getting 18% less oxygen to your brain. our brain survives on oxygen and fat. And without oxygen to our brain, we can feel very sluggish. We can get that brain fog, and it doesn't help our brain cells to develop and mature. The other thing is when we use our throat as our airway, at nighttime, we relax, right? So our tongue falls back in our throat and it occludes our airway. Guess what? You wake up. And that is known as sleep apnea. So when you stop breathing in the night, that's not a good thing for your brain, for your heart, for your body, because we need to have oxygen flowing day and night. So nasal breathing is when your mouth is closed, your lips are together and sealed. The tongue rests on the roof of the mouth. Typically, the tip of the tongue is near the back of your top front teeth, and your teeth are slightly apart. That is at rest, and that is how we should sleep. So, there are certain ways and different things that you can do to help change your sleep habits to become to stop mouth breathing and become a nasal breather. And there are certain books and videos and things that you can learn more about that. But getting back to oral hygiene, the other problem with mouth breathing is that it dries out that protective layer of saliva. Saliva is full of minerals, rich minerals, that help our teeth stay strong. So during the day, we're not doing all the best things, right? So we're eating things that are acidic, we're eating things that have sugar that bring acidity down. And so we are constantly attacking our teeth and gums during the day with eating some of the foods that we choose. And with that, our enamel starts to get weakened. If it weakens too much, we can get a cavity. If our gums aren't cleaned well enough, then we can end up with gingivitis. But when we mouth breathe, we lose that protective layer of saliva. At nighttime, that salivary flow really slows down, but the saliva that's there really helps remineralize our teeth. The constituency, the phosphorus, the calcium in there, they help rebuild our enamel and protect our teeth from those acid attacks that we've put them through all day long. Those are just a few reasons why nasal breathing is important. But let's move on to what our teeth and gums are telling us about our overall health. If brushing your teeth and cleaning in between your teeth leaves you with some pink in the sink or the taste of blood, that is a huge problem. Gums are not supposed to bleed. They're supposed to be nice and strong and stippled and firm and tight. And when I think about like gingivitis, that's a weakening of that epithelial layer. Well, guess what? We have epithelial layers all the way through our system. And leaky gums often means leaky gut. And there's a digestive issue going on there that our gums are now alerting us to. I have had patients who have told me their gums have bled their whole life. Well, this isn't normal, and why hasn't anyone talked to you about this prior to today? Again, was it somebody that was stuck in tradition? Was it maybe the patient wasn't ready to hear the information? Maybe the information was said in a way that was offensive? I don't know. I do know that there seems to be a lot of shaming in the dental chairs, and it can be very hard to hear. And often patients are just deterred and don't want to hear what the hygienist or the dentist has to say. It's important to meet the person where they are. Maybe they are going through a difficult time right now, and maybe today isn't the best time to hear about their oral health. Maybe they just got a diagnosis. Maybe they're helping with a sick child or a husband, and today is just not the day to talk about their oral health. And what about cavities? What do cavities tell us about our health? Well, there's gingivitis that affects the gums. There's periodontal disease that affects the gums. But cavities is a breakdown of the enamel. So is it that the patient perhaps doesn't have enough good solid saliva. Maybe their saliva is just naturally have a low pH. Is there just too much sugar and acidic products, foods that are going in that's causing this enamel to break apart? Did the enamel just not form really well in the beginning of the child's life? So there's lots of factors, again, that can play into the role of cavities. I had this week 4 different patients who had cavities around crowns, underneath crowns, on root surfaces that weren't there a year ago. And when we took x-rays, so something has shifted. As we get older, our mouth does tend to get drier, especially if that person is now taking a new medication. Medication side effects typically is causing dry mouth. And if you have a patient and patients are taking more than one pharmaceutical drug, well, that mouth can become very dry. In essence, we're just putting fuel on a fire when we're having those sugary things without good solid saliva. The good news is that there are ways to combat this microbiome, because if the microbiome, which is made up of a variety of bacteria, fungus, viruses, this is all part of us, right? It's in our mouth, it's in our gut, and the microbiome is essential in helping us thrive. If we have too many bad guys and not enough good guys, we do end up with more cavities, more gingivitis, and the potential to have periodontal disease. Periodontal disease is worse because it's our own body fighting the bacteria that's gotten so far deep underneath the gum that we can no longer brush out the bacteria. We can't clean it out very well. So this bacteria harbors underneath, and viruses live there too, and it gets caught up in the bloodstream. We now have ways to be able to tell the constituency of our microbiome. There are things called salivary testing. I know my office does this. It's a great way for me as a hygienist to know what exactly are we fighting against. We have commensal bacteria that just live there. They're just free floaters, free living, not really causing a problem, just happy to be a bacteria. And that is kind of the green complex. But if we allow that green complex to stick around too long, it's going to invite friends. It has a party. And sometimes this orange complex shows up, and the orange complex, well, they're a little rowdier. And so they're kind of hanging on to the green complex because, well, number one, they've got the great place with the music, the atmosphere, it's fun. So some of the rowdy friends start to show up, and then they start hanging around. But guess what? Then the red complex show up. They're the really rough crowd. They're the ones that are bringing a lot more problems, wear and tear, and they're really stirring things up pretty badly. Well, then we have to try and call the police because the red complex is there, and it's game over. It's time to break up because it's going on way too long. The red complex is the destructive bacteria. It actually starts breaking down the ligaments and the structures around our teeth. It's also in the bloodstream, which is then circulating through your whole system. And it doesn't just stay there. Like, it gets caught up and has been shown to have problems with heart disease, blood pressure, and again, that leaky gums, leaky gut, those are lax. So when we're leaky like that, guess what? Our blood vessels become leaky, and that leads to high blood pressure, because what happens is those blood vessels are no longer strong. They can't keep things together. They get lazy and lax and just tired because they just can't do it anymore. The bacteria has kind of taken over. Our inflammatory process has taken over, and it's a cascade of ill effects. So what are you to do? First of all, it's good to know, what is your baseline of your salivary constituency? Do you have some red complexes in there? If so, we need to get to those immediately. That is the first step. We got to take care of that rowdy crowd. We got to get them out of there. Then we've got to ask the orange complexes to move out. The good news is that there's some really good products out there for both red and orange complexes. But once we get those cleaned up, then we can work on the other things that are less invasive. But the neat thing about these salivary tests is that when specific bacteria shows up, it lets the practitioner know that, oh, you're not getting enough nitric oxide. These bacteria are flourishing because you're a mouth breather. And because you're a mouth breather, you're not getting that changeover of nitric oxide into your body. Nitric oxide is needed for maintaining our blood pressure, for our cardiovascular health. And when we're mouth breathing, these bacteria, they thrive. And it can lead you into more systemic ill effects in the future. The other thing is that some of these orange complexes, like FN and FA, they point to more digestive issues. Today we have more digestive issues than ever. There is, and as checking people's health history, I have a pulse on people's conditions. There seems to be more Crohn's disease, IBS, acid reflux, you name it. There's some type of digestive issue going on. And this FA and FN point to digestive flows. So if those complexes come back high, then I know, okay, we have definitely confirmed that this bacteria is thriving because of your digestive issue. Let's see if we can manage this and figure out the cause of your digestive issue so that we can get this bacteria down. The FN and FA have been found to be linked to colorectal cancers, and it doesn't mean that this person is going to have cancer, but what it means is it certainly turns up their risk. And so if we can get these bacteria down, then their risk goes down as well. So these are just a few tools in the toolbox, and I love that we now have diagnostic tools and tests so that we're not just guessing. I've been a hygienist over 20 years, and for the last 18, 19 years, it's all been guesswork. Just hoping that what I'm doing in the side chair is helping my patients. But yet it's so frustrating that every 3 months, 4 months, 6 months, annually, when they come back, they look exactly the same. And it's very disheartening because I want my patients to get better. But you as a patient need to advocate for your own well-being. Ask questions. Don't just sit silently waiting for things to be over. Ask, how does my periodontal disease, or how does my periodontium look? Did they check numbers? Did they do a full periodontal charting? How's your recession? It could be that your minerals are off. Maybe you need some supplementation. Maybe let's just start at the ground roots. And like I said, the foundation is always what's on your plate. How are you feeding your tissues? How are you feeding your gut? What choices are you making during your day that help promote health rather than feed disease? So this is just a small taste of oral hygiene. I would love to know what your questions are. Please leave comments in the chat. Let me know what you would like to know more about. I'm happy to talk everything oral health. I love talking about hygiene. I think we are living in a time where we have technology, but sometimes it's hard to know what's factual, what to listen to, and what to go with. Sometimes there's these little trends that go on social media, and they're just trends, and there's not really any facts that kind of support these trends. So I'm happy to help you answer questions and uncover maybe your mysteries that are going on with you. So yeah, just leave me a review, leave me a chat. Let me know what you are most interested in. Leave me your questions, and we will talk soon. Keep smiling. Have an awesome day.